Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? All right, that's great. So I hope and I believe all of you are doing well, guys. This is the last session in the series of the Sureshot Final Punch for FMGE exam, and we are going to quickly, skim through the important recently asked questions in the exam. Right, so very important topics that we are going to quickly cover from multiple subjects here. It is mixed pack topics, no particular topic here. I've shared the blank PDF on the Telegram group already. Post session, I'll also share the annotated PDF as well. Okay, and tomorrow we are going to meet again for a session which is going to be exam hall strategy, right? The final session before your exam. So let's try to quickly see how many questions can you expect from all the sessions that we have had so far. Personally, my instinct says a lot of questions is what you would see. I cannot actually define the number here. You guys are going to tell me post exam, so I'll be going to, I'll be waiting to hear that from you post exam. But I've tried to touch upon the most important and the most frequently asked topics, and that's what helps me believe that you would see a lot of questions from the topics that we have discussed. Okay. Right, of course, Dr. Pragati, that goes without saying, right? My blessings and prayers are always with each one of you. I'll be sincerely praying for each one of you that you guys do really well in your upcoming exam. Okay, so let's start discussing few important topics here from multiple subjects. I've tried to segregate the topics also subject wise, so that you get a idea कि कौन सा subject मुझे कितना याद आ रहा है नहीं आ रहा है. Whatever subject you think while we are discussing is this is something I did not remember, go back and revise that subject then. Okay. Okay, all right, so let's start with the first one. Which is the muscle which helps in the opening of the jaw? Very important and very frequently asked question. Which is the muscle of mastication which helps in opening the jaw, guys? Yes, absolutely right, Shiravali, correct. So remember, jaw opening is something which is lowering the jaw, lowers the jaw. L for L is lateral pterygoid. Okay, so remember, it is the depressor. Okay, depressor of the mandible, opening the jaw, lowers the jaw. It is lateral pterygoid. How do you identify lateral pterygoid in the images? Remember the insertion, it is related to the टेम्पोरोमैंडिबुलर जॉइंट का जो आर्टिकुलर डिस्क है वहां पे जाता है ये लैटरल टेरिगॉइड. मैंडिबल के बाहर आता है मैसेक्टर, अंदर आता है मीडियल टेरिगॉइड, एंड यू हैव टेम्पोरालिस. दीज आर द मसल्स ऑफ मैस्टिकेशन. Supplied by what nerve? Supplied by mandibular nerve. These are the muscles of the first arch. Okay. Next one, what is the lining of the trachea? The epithelium topic has been covered with all the tricks in the Radsynapse app. This is one of the recent question. Trachea की lining क्या होती है? Without trachea ki lining, what is the lining of the trachea? What epithelium is it? PSCC, right? It is PSCC, pseudostratified ciliated columnar epithelium is what you see in the trachea. Okay, trachea is pseudostratified ciliated columnar. PSCC is what you need to remember here. Important nerve injuries, remember the book test. ऐसे जो book वाली image होती है, book test, from and sign. What nerve are you testing for when you have that book test? What is that nerve that you are checking for when you have the book test? So remember the mnemonic ulnar nerve, ulnar is A, B, C, D, E, F. Okay, so the book test, from and sign, that's basically for ulnar nerve. You are testing for which muscle when you are testing for this book test? Batao? What muscle are you testing for? So which is the muscle here? Which pollicis muscle is supplied by ulnar nerve? Very important. Remember, it is the adductor pollicis. Okay. Adductor pollicis is the only pollicis muscle which is supplied by the ulnar nerve. Adductor pollicis. Okay. Adductor pollicis. Versus, what is the test for abductor pollicis? The rest of the pollicis muscles, thenar muscles, it is the median nerve. Right. So इसके लिए कौन सी टेस्ट करते हैं? You have the pen test here. Remember all the PPPs are for the median nerve. M के साथ जाता है P. Pen test, Pope's benediction hand, right pointing index, ape P का ape thumb, ape hand. That is all basically your median nerve. Foot drop and wrist drop. Foot drop. Foot drop is what nerve? Common peroneal nerve. Okay, and which is seen with fracture of where leads to the injury to common peroneal. Peroneal matlab lateral side. You have fibula, which is the lateral bone. Remember, fracture fibula neck ke wahan, basically you will have common peroneal nerve injury. Okay. Next one that you have, wrist drop. For the upper limb, remember the mnemonic Dr. Kuma. Drop is seen with radial nerve, claw with ulnar nerve, and median nerve leads to ape thumb or ape hand. Okay. So very, very important, foot drop, wrist drop. Another important question here is fracture of the medial epicondyle of the humerus. Right? Medial epicondyle of the humerus, which is identified by towards the humerus ka head. That will be associated with injury to what nerve? Remember, medial side pe kaun si nerve hoti hai? Medial side pe hoti hai ulnar nerve. Okay, that is the ulnar nerve. Very, very important. Okay. Going to next one, some important physiology one-liners. Inhibin, mechanism of action. Okay. Inhibin, mechanism of action. क्या होता है? Inhibin का mechanism of action. It is acting on what hormone? Inhibin basically inhibits FSH. Remember FGHI, they come close together. The alphabets FSH and inhibin, they are coming together. So inhibin is going to be inhibiting the FSH. Inhibin हमारे ovarian tumor में किसका है? Ovarian tumor में किसका मार्कर है? Inhibin कहाँ से आता है? Granulosa cells, right? So remember again, EFGHI. So basically FSH, granulosa cells, inhibin, they are interrelated. Okay, they are interrelated. And LH is the one, L for L, which controls the Leydig cells, and Leydig cells is the one which produces the testosterone. Okay, so LH, Leydig cells, testosterone. Renin is secreted from where? Renin comes from where? The JG cells, juxtaglomerular apparatus, the JG cells is what is secreting renin. What is the receptor here responsible for renin secretion? Remember, it is beta 1 mediated. Okay, it is beta 1 mediated, that is renin. Maximum reabsorption of the majority of the substances occurs in what part of the nephron? It is PCT, right? PCT, the maximum reabsorption even of the water takes place in the PCT. But remember that when there is ADH which is coming, ADH, antidiuretic hormone, leading to the water reabsorption basically, it is acting where? Where does the ADH act? ADH acts where? ADH acts on the collecting duct. Okay, ADH acts on the collecting duct, while you have otherwise normal reabsorption of water maximum that's taking place in the PCT. Okay, that's taking place in the PCT. Okay, clear with everyone? Sarcomere is from what line to what line, what zone to what zone? Remember, sarcomere is sarcomere, and it is from the Z line to Z line is what you have is sarcomere. Is from Z line to Z line. And Z line is present in the center of I band. Remember, MAZI is the mnemonic MAZI. MAZI is Z and I go together. So Z is in the center of I. Okay, Z is in the center of I. Clear with everyone? Right? Okay, great. Going to next one. Alcohol is something which is an important topic for your exam, you know, in whatever way. And so remember, alcohol increases NADH levels. Right, so basically it is increasing the NADH-NAD ratio. It increases the NADH levels, right? Because you have alcohol dehydrogenase, then comes acetaldehyde, aldehyde dehydrogenase. So that increases the NADH levels. And remember, these increased NADH levels, they inhibit gluconeogenesis. And that is why alcoholics generally have hypoglycemia. Okay, they have hypoglycemia, which is commonly seen in alcoholics. And Also, if I talk about the vitamin deficiencies, what vitamin deficiency is common in alcoholics? A very frequently asked question. Remember, it is vitamin B1 deficiency, that is thiamine deficiency. It is what is commonly seen. And this vitamin B1, that is thiamine deficiency, that is why it leads to Wernicke's encephalopathy, another important question. Okay? So remember, Wernicke's is because of B1 deficiency. Wernicke's is Wernicke's B1, which has the triad of Goa: global confusion, ophthalmoplegia, and ataxia. Ophthalmoplegia is given in the question in the form of nystagmus. Okay, nystagmus is given. So when you are giving, you're treating the alcoholic, first you will give thiamine or first you will give glucose. What will you give first? Remember, first you have to give thiamine followed by glucose, that is dextrose is given. First is thiamine because for utilization of this glucose, thiamine is important. Okay, thiamine is important here. Yes, in Wernicke's, remember mammillary body is involved. There's mammillary body atrophy for B1 deficiency. The test that you do is very important, RBC transketolase test. RBC transketolase is what you do for thiamine deficiency. Okay. Going to next one, paroxysomal defects, another important topic for your exam. Zellweger's and Refsum's. Okay. So remember that Zellweger's and Refsum's. In Zellweger's, what happens is ZE, remember there are 0 peroxisomes which are present. There's a defect in the peroxisomes formation. Pegstein is affected. When you say A, B, C, D, E, F till Z, Z comes at the last. So it's a very long chain fatty acids which accumulate. Very long chain fatty acids accumulate here. Okay, remember there's accumulation of very long chain fatty acids because very long chain fatty acids first go to peroxisomes, they become short and then they go to mitochondria. Okay, so यहाँ पे phytanic acid भी accumulate होगा but very long chain fatty acids भी accumulate होगा. This is also called as cerebrohepatorenal syndrome, right? The brain, the liver and the kidney is affected. Okay, while in Refsum's, remember Refsum is only F, that is phytanic acid accumulation. यहाँ पे phytanyl CoA hydroxylase वाला enzyme deficient होता है. And remember Refsum's RE in the clinical features, it also has retinitis pigmentosa which is present. Retinitis pigmentosa, phytanic acid वाला enzyme यहाँ पे deficient है. ठीक है? Next one, what is this condition where there is history of self-mutilation in the patient, nail biting hai, self-mutilation hai, increased uric acid hai. What is the diagnosis here? What is the diagnosis here? Yes? Very good. This is Lesch-Nyhan syndrome. Okay? This is Lesch-Nyhan syndrome, very important, self-mutilation, hyperuricemia. Here it is, what pathway is defective here? The enzyme is the HGPRTase, absolutely right. There is complete absence of HGPRTase enzyme here. What is the pathway which is defective here? What is the pathway which is defective here? What pathway? This is basically purine salvage wala pathway which is defective here. HGPRT is the enzyme of purine salvage. And what is the inheritance pattern of Lesch-Nyhan? Remember the story we have discussed in Sureshot Medsynapse app. It is X-linked recessive, not autosomal recessive, not mitochondrial. Okay, Leber's is mitochondrial. Lesch-Nyhan is X-linked recessive. Okay, so it is X-linked recessive, the story of Bruton, Lesch-Nyhan, Granny, right? Six Goons, Whiskey, all that story. I hope you remember that. Yes. Going to next one, another important question. Cherry red spot is with sphingolipidosis. Remember, cherry red is 2 words. So, 2 word wala sphingolipidosis kaun se hai? Tay-Sachs, Niemann-Pick's, right? So, how do you differentiate the two is? With hepatosplenomegaly. HSM is hepatosplenomegaly. So remember, it is big organs. Big is pick. It is Niemann-Pick's. And no hepatosplenomegaly, tiny organs in Tay Sachs, big organs in Niemann-Pick. So that is how you differentiate. This has been asked in NEET PG exam also, and it's also basically has been asked in FMG exam, INICT, all the exams. Rett syndrome, Dhwani, will have the history of milestone regression and the stereotypical movements of the hand. Seen in girls, MECP2 gene is affected. Trofinetide is the drug which is given there. Okay? Yes, correct. Foam cells is what you see in Niemann-Pick. Sphingomyelinase is the enzyme deficient there. Okay, zebra bodies, absolutely right. So again, there's a story of Niemann-Pick. I hope you remember, all of you remember that. A man crossing a zebra crossing, picking or digging the nose, right? Foam coming out on the zebra crossing. That is Niemann-Pick wala story. Okay. Very, very important question frequently asked, this crumpled paper appearance. Remember, this is seen with Gaucher's disease. Gaucher's is ouch, ouch. Patient comes with a lot of pain. What pain is there? Bone pain. Okay, it involves the bone, can lead to anemia, pancytopenia plus bone pains. Right, so remember Gaucher's, ouch, ouch. Patient is crying ouch, ouch. You give the paper to the patient. Right, so remember Gaucher's is crumpled paper appearance. What is the enzyme deficient here? Glucosidase or galactosidase? Remember Gaucher's has U in its spelling. So it is glucosidase and not galactosidase. Which glucosidase? It is beta glucosidase. Okay, alpha glucosidase is Pompey's. Okay, this is beta glucosidase, glucocerebrosidase, which is deficient here. Correct. Right? Going to some important point in vitamins that has been asked in the recent exam as well. Pellagra-like features with increased urine 5-HIAA. You know that's a marker for carcinoid. So this is going to be carcinoid. Pellagra-like features with increased urine amino acids, not 5-HIAA, has been asked in recent exam. So that is basically going to be Hartnup disease, where there's a problem with tryptophan absorption in the gut and in the kidney. Okay, so that is what is Hartnup. यूरिन में अमाइनो एसिड्स बढ़ेंगे, कार्सिनोइड में 5-HIAA बढ़ेगा. Eating of white polished rice leads to deficiency of which enzyme, which vitamin basically? White polished rice खाने से thiamine deficiency. Okay, maize eating, maize M को आप reverse करो, this is going to be B3 deficiency. Raw egg white containing avidin inhibits biotin absorption, right? So remember, it is going to be biotin, B7 deficiency. And a vegetarian has what deficiency? A vegetarian vegan is B12 deficiency. B12 deficiency has increased methylmalonic acid. Okay, it has increased methylmalonic acid. Clear with everyone? Never forget with B3 deficiency, the Casal's necklace, which is a very favorite image for the exam. Okay. Bitot spots, bitot spots. Remember, eye image hota hai, it is seen with vitamin A deficiency. Okay, that's seen with vitamin A deficiency. It is what stage in the vitamin A deficiency? कौन सी stage है वो? Remember, bitots, BI is IB, that is stage 1B. Bitots is BI is IB, that's stage 1B. What vitamin is given to prevent neural tube defects? It is folic acid. Folic acid, that is vitamin B9, prevents neural tube defects. It does not treat the neural tube defects. It is to prevent the neural tube defects. Okay, it is to prevent the neural tube defects. Done with this? Going to next one, very favorite image for the exam. What are you seeing here? Escoff bodies, which are seen where? Rheumatic heart disease. Okay, these are the Escoff bodies that you are seeing here. Rheumatic heart disease, Escoff bodies, caterpillar-like cells, Anischkow cells, McCallum patches. That is what you see there. Okay. What is the earliest marker to rise after MI? CPK, MB, troponin T, troponin I, LDH, myoglobin. What is the earliest one? Yes, earliest marker after MI is Very good. It's myoglobin. Okay, the earliest marker to raise is myoglobin. Remember last, L for last, one is LDH. Myoglobin is the earliest one. फिर आता है CPKMB, फिर आता है आपका troponin और last में आता है basically LDH. Okay. Remember Kaposis sarcoma, this is one of the image has been asked in recent NEET PG exam. HIV पॉजिटिव पेशेंट है और ऐसे पैलेट में कुछ नोड्यूलर लीजन्स पर्पल कलर के दिख रहे हैं. रिमेंबर दिस इज Kaposis sarcoma. I hope we should be able to judge this. Okay guys, give me a minute, otherwise this will go off. Right, just give me a couple of minutes. I'll just connect the charger and be back. Just a minute. Am I audible and visible, everyone? Okay, right. So this is Kaposis sarcoma. Remember next time previously in NEET PG exam this image was given. Next time they can give you an image which is basically like the skin nodules, right? It is skin form, it is oral form that can come on the palate. Yes, the CD count is less than 500. पहले ही आ जाता है Kaposis. It's an AIDS defining illness. Herpes, कैंडिडा या टीबी ये सब पहले ही आ जाते हैं, लेस देन 500 पे ही आ जाते हैं. एंड सो इज Kaposis sarcoma. And remember Kaposis sarcoma is associated with what organism? HHV8. Okay, it is associated with HHV8. Bacillary angiomatosis, Kaposis sarcoma skin lesions can look similar. The difference is Kaposis में न्यूट्रोफिल्स नहीं होते हैं, बैसिलरी एंजियोमेटोसिस में न्यूट्रोफिल्स भी दिखेंगे. ठीक है? Is this clear with everyone? All right. Going to the next one, pharmacology, recent questions. What is the mechanism of action of methotrexate, favorite for all exams? It inhibits dihydrofolate reductase. Okay, it inhibits dihydrofolate reductase, and that is why folic acid nahi hai, so even this can cause megaloblastic anemia. Right, stomatitis is a common side effect. There's pulmonary fibrosis. There can be liver, can also be affected. What is the drug of choice for GIST tumors? GIST में CD marker क्या होता है? Remember, I7 is 17. It is CD 117 is the marker there. C. Yeah. So here also the drug of choice is imatinib, which is also the drug of choice in CML. GIST arises from the interstitial cells of Kajal, right? Stomach is a common site there. Okay. Next one, mechanism of action of ethosuximide. So for what do we use ethosuximide? The typical absence seizures. Ethosuximide absence seizures classically has 3 Hz spike and wave pattern precipitated by hyperventilation. Right? School का बच्चा होगा जहाँ history होगी staring वगैरह की, that's the classical history given. 3 Hz spike and wave pattern. If it is less than 3, 2 Hz वगैरह है, then it is Lennox-Gastaut syndrome. 3 है तो absent seizures वाला है. And remember, ethosuximide T for T, it is T-type calcium channels that it inhibits. It inhibits T-type calcium channels in the brain. In the heart, you have L-type. Okay? Clear with everyone? Right? Huh. Next one, anti-cancer side effects. Recent question. Hand-foot is seen with. Hand-foot is seen with. Remember, hand-foot. Foot is foot. Fu. It is 5-fluorouracil is hand-foot. एक बॉडी का एक एंड है फुट, दूसरा एंड है यहाँ पे कैप. सो रिमेंबर, फुट एंड कैप कॉज हैंड फुट. The cap is the capecitabine. This is what was asked in the exam. Okay, it is capecitabine and you have 5-fluorouracil. Capecitabine is actually the prodrug. It metabolizes to give 5-fluorouracil. Pulmonary fibrosis is seen with which anti-cancer drugs? Pulmonary fibrosis. Remember, affecting both the lungs is BB. Both lungs affected with busulfan and bleomycin. Okay, BB wale drugs, that is busulfan and bleomycin, they affect the lungs, they cause pulmonary fibrosis. Okay, right. Methotrexate also causes pulmonary fibrosis. Antiarrhythmic causing pulmonary fibrosis. Antiarrhythmic, very, very important. Remember, amiodarone causes pulmonary fibrosis. What anti-cancer drugs are cardiotoxic? Very good. Doxorubicin, daunorubicin, that's basically anthracyclines. Anthracyclines, which are doxorubicin, daunorubicin, these are cardiotoxic, right? So you need to do echo while giving these drugs to monitor. And what is the drug given to decrease their toxicity? Remember, dexrazoxane. Dexrazoxane, DDD वाला, okay, दिल को affect करने वाले DD. Doxorubicin, daunorubicin, उनकी toxicity कम करने के लिए भी D वाला drug, that is dexrazoxane, DDD. Okay, right. Hemorrhagic cystitis. Hemorrhagic cystitis, remember cystitis, CY, this is seen with cyclophosphamide. Okay, cyclophosphamide, you give Mesna. Right? So remember, this is hemorrhagic cystitis is cyclophosphamide. Okay, doxorubicin also has radiation recall syndrome is seen, not used in radiation recall. Okay, when you have given doxorubicin, after that you give radiotherapy, then the patient will experience a redness in the area, right? So that is what is radiation recall. Radiation दिया, फिर doxorubicin दिया, तो वहाँ पे redness होगा वो radiation वाले area में. That is radiation recall. Okay. All right. And which is the most emetogenic anti-cancer drug? Remember, cisplatin. Okay, cisplatin, you give ondansetron, then you have late wale mein baad mein you have aprepitant, which is the drug which is used for chemotherapy-induced vomiting. Which is the oral hypoglycemic agent which cause hypoglycemia? Oral hypoglycemic agent causing hypoglycemia. Why? Because it increases the insulin release. Insulin का surge कौन करता है? Surge of insulin is seen with sulfonylureas. Okay, so sulfonylureas, which includes your GLGL wale drugs, right? Glimepiride, gliclazide, glipizide. So remember, these are the drugs there. Okay, clear with everyone? राइट, सो ऑप्शन में दिया गया था ग्लिमिपराइड, दैट्स बेसिकली योर सल्फोनिलुरिया. Another important question, sulfonylureas act on what channels in the pancreas? They are potassium channel blockers, not openers. By blocking the potassium, causing depolarization, they increase the insulin release. Okay, they increase the insulin release. Next one, what is the drug of choice in delirium tremens? Remember, delirium tremens after alcohol withdrawal is seen on day 2, day 3 after 48 hours, right? It does not come immediately. Earliest is the tremors, delirium tremens. Delirium is where the patient is disoriented, autonomic hyperactivity is there and there are tremors. तो टू पैसिफाई ब्रेन को शांत करने के लिए बेंजोडाइजेपिन देंगे, जैसे लोराजेपाम देंगे, और साथ में क्या देना पड़ेगा? थाइमीन देना पड़ेगा. Okay, साथ में you have this thiamine because that's a deficiency you see in alcoholics. Okay, that's important. Going to next one, some important points in FMT. Remember, MTP is the amendment in the MTP Act is something which is very very important. OC pills failure की वजह से कितने वीक्स तक कर सकते हैं फिर MTP अगर OC pills failure की वजह से there is pregnancy? Remember, for OC pills failure, it is 20 weeks. If it's a rape victim, right, anomalies are there, then it is still 24 weeks. After 24 weeks, it can be done for substantial anomalies, but you need board approval. Okay, but for that, you need the board approval. OC pills 20 weeks, rape victim 24 weeks. One doctor opinion is needed now till 20 weeks. Previously, it was till 12 weeks. Now it is 20 weeks. 20 to 24, दो doctors का लगेगा. After 24, board लगेगा. Medical board will be required after 24. ठीक है? Right. Cherry red hypostasis. You have all the mnemonics again in the Radsynapse app with the hypostasis, the PM lividity wala color. Cherry, remember cherry. Cherry, my neighbor drives the car. So remember, car is carbon monoxide. Okay, carbon monoxide poisoning में यहाँ पे रहेगा cherry red hypostasis. And carbon monoxide में classically history आती है. Carbon monoxide is from the smoke, right? वो बाथरूम में गीजर वाला है, क्लोज स्पेस है, गैरेज है, जहाँ से स्मोक आ रहा है, फायर वाला है, दैट इज वेयर देयर बी कार्बन मोनोक्साइड पॉइजनिंग. हाइड्रोजन सल्फाइड नहीं, अहमद खान, रिमेंबर H2S हाइड्रोजन सल्फाइड के साथ कौन सा कलर का होता है? व्हाट वाज द निमोनिक फॉर दैट? रिमेंबर द बैंक नेम HSBC. H2S is BC, that is bluish green. Bluish green is the PM lividity. Rotten neck smell is what you have with hydrogen sulfide. Okay? Very good. Correct, Dhwani. Then you have, which is the poisoning which is similar to tetanus? There is opisthotonus, right? Arching hai, back arching hai. Similar to tetanus, ST. Similar to tetanus. ST is that is strychnine. Okay, strychnine ST is similar to tetanus. Remember that. Okay, and strychnine acts on post-synaptic or pre-synaptic. कहाँ पे act करता है? Remember, ST strychnine acts on post-synaptic वाला glycine, while tetanus, botulism is pre-synaptic. Okay, clear with everyone? Yes, correct. Going to some important points in ENT, the most frequently asked topics in ENT, very, very important. Laryngomalacia. What is the classical history given in laryngomalacia? A baby who has what kind of stridor? What kind of stridor do you have in larynx? Remember, जब upper airway की pathology है तो inspiratory stridor होता है. This is going to have inspiratory stridor, not expiratory. It becomes better in the prone position, right? Do you need to do anything for here? No. Spontaneous वाला wait and watch approach है यहाँ पे. Omega shaped epiglottis दिखता है, right? Folding हो जाता है epiglottis का. Omega shaped epiglottis is what you see here in laryngomalacia. Juvenile nasopharyngeal angiofibroma, another important topic. Juvenile means it's in a juvenile. कोई teenager, adolescent, male होगा. Mass hoga, right, which can cause hypertelorism, which is very, very vascular. It's an angiofibroma. That means it is very vascular. That means it bleeds. And that is why, will you do a biopsy here? No. Okay, no biopsy is done for JNA. So what is the investigation of choice? Very important potential question for your exam. What is the investigation of choice which you see here? Investigation of choice is CECT, right? Contrast enhanced CT. Any tumor, any mass, you do a contrast scan. Okay, so CT angio or CECT is what you do here, right? The bleeding history will basically be given as a history of epistaxis, recurrent epistaxis. Okay, so JNA, CECT is the investigation of choice. Very good. Hallman-Miller sign on CT is what you see here. Okay. Next one, patulous eustachian tube has been asked, like, in two different ways in the FMG exam. Patulous eustachian tube, when does it happen? So when this is the eustachian tube, imagine eustachian tube connecting the ear to the nasopharynx, middle ear to the nasopharynx. उसके आसपास यहाँ पे फैट होता है. कौन सा फैट बोलते हैं इसको? Ostman fat pad. If that fat pad goes away, then the tube becomes patulous. So in that case, what is the history classically given here? History of patient hearing own breathing sound. ठीक है, खुद का ही वो ब्रेथ का साउंड फिर सुनाई देता है पेशेंट को. दैट इज द हिस्ट्री विच इज गिवन हियर. फैट पैड जब चले जाएगा, राइट, वेट लॉस हुआ है, उसके साथ फैट चले गया है, सो दैट विल लीड टू पैचुलस यूस्टेशियन ट्यूब. दिस हैज बीन आस्क्ड ट्वाइस. ओके, राइट. Nasopharyngeal carcinoma, on the other hand, remember carcinoma cancer generally in elderly. Classically, what is the history given? There are a lot of lymph nodes with cervical lymph nodes. Nasopharyngeal carcinoma blocking the eustachian tube leading to serous otitis media. So when you have an elderly patient with unilateral serous otitis media, cervical lymph nodes, then you should always think of nasopharyngeal carcinoma. And remember that the most common site of origin here is fossa of Rosenmuller, right? Torus tuberous के यहाँ जो आता है उसके पीछे fossa of Rosenmuller. Trotter's triad होता है, correct, right? NPC, neuralgia, then palatal palsy, and there is conductive hearing loss, not sensory neural hearing loss. Okay, there is conductive hearing loss. You give radiotherapy in the management. Coming to adenoid hypertrophy की history में classically क्या होता है? It's a child. The adenoid hypertrophy blocking the nasopharynx, so nose breathing difficult हो जाता है. That is why this baby has what breathing? Mouth breathing होता है. ठीक है, राइनो ले लिया, क्लॉजा होगा, नेसोफैरिंक्स वाला एरिया बंद हो रहा है, क्लॉजा होगा क्लोज्ड, माउथ ब्रीदिंग होगा. The hypertrophied adenoids blocking the eustachian tube, again that's going to be serous otitis media, right? Serous otitis media affecting the hearing in the child, right? The question mentioned that कि टीवी बहुत हाई वॉल्यूम पे सुन रहे हैं, है ना? So that is basically क्योंकि hearing difficulty है. So mouth breathing होगा, snoring होगा, crowding of teeth होगा, high arch palate होगा, that is adenoids hypertrophied, right? And what do you do in management? Adenoidectomy करना है ना? Adenoidectomy plus grommet insertion. Okay, grommet insertion करना पड़ेगा for ventilation. Okay, so adenoidectomy plus grommet insertion. Right. Otosclerosis, again important one here. Otosclerosis, remember, increases in pregnancy में worsen होता है. Otosclerosis is what kind of hearing loss? It's a conductive hearing loss, right? Stapes, footplate यहाँ पे ossification fixation हो रहा है. Stapes footplate का otosclerosis में it's a conductive hearing loss. And remember, classically in audiogram, auto के साथ आता है car. Remember, there is Carhart's notch at 2K hertz in the bone conduction. Okay, Carhart's notch is seen. Remember, it is conductive hearing loss. Okay, this is something that can be associated with the osteogenesis imperfecta, also blue sclera Van der Hoef trials. Meniere's disease. Meniere's disease is SNHL. Triad that you see here is TVS. Tinnitus, vertigo, SNHL. Okay, Meniere's is SNHL, not CHL. It is tinnitus, vertigo, SNHL, which is seen here. It is endolymphatic hydrops, right? So that's basically distending the endolymph जहाँ पे भी है, right? वो distend हो रहा है. So you can give diuretics in the treatment, right? And what kind of audiogram do you see here? Upsloping, downsloping? Right. Remember men, young men who are on the upslope of their career graph. Right. So remember they have upsloping graph that tells you that lower frequencies are affected. While in presbycusis, old age में क्या होता है? Presbycusis में down going है. Okay. So the higher frequencies are affected first in presbycusis. Okay. Renese negative is seen in CHL or SNHL. Conductive, sensory neural. Where do you see Renese negative? What is the mnemonic for that? Remember con. Conductive is Renese negative plus unilateral severe SNHL where you can get false negative Renese. Unilateral severe SNHL is false negative. Okay, plus conductive hearing loss. Okay. Then for the newborn, this is another favorite question in ENT. Newborn में hearing का screening के लिए कौन सा test करते हैं? Otoacoustic emissions. Okay, otoacoustic emission is done. BERA is done only in high risk babies like ICU babies, not in everyone. But in every newborn for screening, you can do otoacoustic emissions. And remember, otoacoustic emissions, O for O, they are coming from outer hair cells. Okay, they are coming from outer hair cells. Is this clear with everyone? Okay? Yes. EAC अगर atresia है कोई patient में, right? तो उसमें आप कौन सा implant डालोगे अगर EAC atresia है तो? EAC atresia तो sound तो यहाँ से conduct कर ही नहीं रहा है. So basically what will you do is BAHA. Bone anchored hearing aid. Bone directly bone पे anchor कर देते हैं hearing aid. Bone anchored hearing aid is what we use when there is EAC atresia. Okay, when there is EAC atresia. ठीक है? Right, Dr. Bhatt, please forget about the past. Right, somebody like you who was stuck at just 148 does not mean anywhere that you were less intelligent. Or, it's just sometimes the luck. And be sure and have the faith that this time you're definitely going to crack it, and that too with a good score. Okay. So, get rid of that fear and have all the faith. Okay. That's going to help you clear this exam. Okay. Going to the next one, ophthalmology के some important points here. Diabetic retinopathy के patient में, basically diabetes वाले patient में अगर vitreous hemorrhage दिया गया है history में, what kind of retinopathy does vitreous hemorrhage indicate? It is basically proliferative diabetic retinopathy. Okay, proliferative diabetic retinopathy, vitreous hemorrhage, pre-retinal vitreous hemorrhage. And when there is vitreous hemorrhage, because of the hemorrhage in the vitreous, remember the fundus cannot be seen. There is loss of the fundal features that is going to be mentioned. It leads to the acute painless loss of vision in diabetic patients. While when you have history of curtain drawing कि आँख के सामने ऐसे एक पर्दा आ रहा है, basically that पर्दा वाला history, curtain drawing is the history of retinal detachment. Okay, जब curtain drawing दिया है तो वो है retinal detachment. जब fundus नहीं दिख रहा है, basically that is going to be vitreous hemorrhage. Okay, that's vitreous hemorrhage. Correct. When you see this foamy appearance in the eye, this is the Bitot spot. Again, vitamin A deficiency, stage is 1B. Where do you see oil drop cataract? Which condition? Oil drop cataract is galactosemia. What is the enzyme deficient? Remember, Galliput. Galactose 1-phosphate uridyl transferase. Galliput, galactosemia, oil drop cataract. Wilson sunflower cataract. Rosette cataract, blunt trauma. Blunt trauma, rosette cataract, penetrating trauma, sympathetic ophthalmia, right? That is what you have there. This is favorite, like NICT में 2 बार आया है, FMG recent में भी आया है, कुछ chemical burn हुआ, चूना वगैरह गया आँख में. What is the initial management that you will do is thorough irrigation of the eye, right? Thorough irrigation of the eye so as to prevent the further damage. First thing that you do is irrigation karo. Right, so that is what you have in chemical burns. Remember, irrigation is very, very important. Right. Blindness definition, remember the update here. Now it is WHO definition is the presenting visual acuity. Okay, the presenting visual acuity is less than 3/60 in the better eye. Okay, not the better, the best corrected. It is the presenting visual acuity less than 3/60 in the better eye. If a patient has inability to close the eye, that means which nerve palsy or injury are you thinking about? अगर कोई patient आंख नहीं close कर पा रहा है तो yes. Yes, in foreign body, remember CT is better, MRI you avoid because you don't know it's a metallic foreign body, so MRI is contraindicated. CT, CT करने की जरूरत नहीं है, plain CT चल जाएगा. Very good. That's the seventh nerve because it's a facial one, right? Orbicularis oculi, which helps in closing the eye. So it is seventh nerve injury when there is inability to close the eye. Okay. So that is why when there's facial nerve injury, remember it can lead to exposure keratitis. So you need to do tarsography. Okay. Tarsography needs to be done. Exposure keratitis hoga. Ptosis with pupil constricted, ptosis with pupil dilated. What are you thinking about? Ptosis with pupil constricted. Okay, remember ptosis. Pupil constricted is meiosis. This is going to be Horner's syndrome. Sympathetic gaya hai. And ptosis with pupil dilated is what you have in third nerve palsy. Third nerve palsy is ptosis with pupil dilated because third nerve constricts the pupil. When it is gone, there's going to be dilatation of the pupil. Where do you have pupil sparing ptosis? Ptosis है लेकिन pupil spared है. That is seen with diabetes mellitus. Okay, that is seen with diabetes mellitus. The pupil is spared. Okay. Abduction is lost. The lateral movement of the eye is lost. Remember, this is lateral rectus, LR6. What nerve is this? This is sixth nerve injury. Abducent nerve when gone, the abduction will be gone. Extraocular muscles is third nerve except LR6 and SO4. Superior oblique is the fourth nerve. Going to next one, some important points in medicine. When they give you meningitis with increased PMNs, right? What is this? Neutrophils बढ़ गए हैं तो कौन सा meningitis है? Bacterial meningitis. Glucose normal है तो कौन सा meningitis है? Viral meningitis. Okay, we have discussed this in the first session also. Viral meningitis, glucose normal, bacterial meningitis, PMNs increased. Another question, what is the most common sequelae following this bacterial meningitis? Remember, meningitis along the auditory nerve जाके फिर SNHL कर सकता है. The most common sequelae is SNHL. Myasthenia gravis, history of mediastinal mass is given. What mediastinal mass are we talking about when it's myasthenia gravis? We are talking about thymoma. Thymoma comes in what mediastinum? Anterior. Remember the 4 T's in the anterior mediastinum. You can have thymoma, thyroid, terrible lymphoma, teratoma, that comes in the anterior mediastinum. What is the most sensitive diagnostic test for myasthenia gravis? The most sensitive is single fiber EMG, electromyograph. Okay, so single fiber EMG is the most sensitive. Clear with everyone? System EB scan, again favorite. Exam में बहुत बार आता है, very favorite for the exam. System EB scan is something that we do for hyperparathyroidism, right? To locate that parathyroid adenoma, system EB scan. The classical history in hyperparathyroid is stones, bones, groans and moans, right? There is nephrocalcinosis, renal stones, bone pain, right? So that is system EB scan for hyperparathyroidism. Correct. Coming to some important points in surgery here. Remember burns percentage calculation. What rule do you have here? Wallace rule of 9. Okay, this head, this area basically is how much percentage? So remember this is 1/9, the upper limb is another 9. Okay, so the head face wala area basically is 19%, each upper limb is 9%. Then you have chest, abdomen or piche bhi back, upper back, lower back, it's 9, 9, 9. Chest is 9, abdomen is 9, each lower limb, remember, is how much? 9 आगे 9 पीछे, ऐसे कैलकुलेट करके याद रखना कि lower limb is 18 and 18. Okay, is this clear with everyone? Rashmi, logically socho. Okay, don't mug up the things. You know, otherwise you'll get confused. Myasthenia gravis में there is receptor antibodies against acetylcholine receptor. So if this is the synapse here, acetylcholine is released from that presynapse, right? The presynaptic terminal से acetylcholine आ रहा है. Then it goes and acts on the receptor. Where is the receptor present? Postsynaptic. So myasthenia gravis is postsynaptic, the receptor antibody. Okay. Tetanus में there is inhibition of the release of GABA. Inhibitory neurotransmitter inhibit हो रहा है, इसीलिए acetylcholine बहुत ज्यादा है, इसीलिए मसल कॉन्ट्रैक्शन ज्यादा हो रहा है. ठीक है. गाबा रिलीज इनहिबिट होता है टेटेनस में. राइट. So remember, head is 9, upper limb is 9, upper limb is 9, lower limb is 18, 18, and then you have chest 9, abdomen 9, very, very important. If they ask you that, कि एक जो palm है, okay, how much percentage of the body surface area do you count? Palm is basically 1%, okay, palm is 1%, okay. Next one, what are you seeing here? Is it a branchial cyst, yes or no? Is it a branchial cyst? See, branchial cyst comes along the sternocleidomastoid. It's more laterally located. While thyroglossal cyst comes in the midline. जैसे thyroid आ रहा है, ठीक है? Thyroglossal. So basically thyroid tissue वाला remnant वाला है. It moves with deglutition. It moves with tongue protrusion. This in the midline. This is thyroglossal cyst that you are seeing here. Moves with tongue protrusion, moves with deglutition. Okay, this comes in the midline. Most common location is subhyoid. कहीं भी हो सकता है. Most common is the infrahyoid, subhyoid. What surgery? What is the name of the surgery for thyroglossal cyst? Very good. Remember thyroglossal cyst. Cyst के लिए करते हैं cyst trunk operation. Okay. Cyst trunk operation is done for thyroglossal cyst. When they give you scrotal swelling with testes not palpated separately, the swelling is brightly transilluminant. मतलब transilluminant swelling है, मतलब ये क्या containing है? ये fluid containing है. So what swelling are they talking about? They are talking about hydrocele. Hydrocele के अंदर testes है, तो इसलिए separate palpate नहीं होगी. Brightly transilluminant is going to be it's going to be hydrocele. Chinese lantern pattern is seen with transillumination. C for C. Chinese lantern is epididymal cyst. Epididymal cyst. Barley fluid is spermatocele. Okay, spermatocele will give the barley fluid. Then you have revised trauma score के components क्या है? All this has been discussed in the Sureshot, right? We are doing a quick revision of the important topics. RTS के components है RTS. Respiratory rate. Trauma के patient में the first scoring that is done, which is GCS. And you have S for systolic blood pressure. Okay, S for systolic blood pressure. So remember, it is RTS. You have respiratory rate, GCS and systolic blood pressure. These are the same components similar to QSOFA. Okay, similar to QSOFA, these are the same components. Okay, same components. Going to the last one here, some important points in OBGY that have been asked. In emergency contraception, what do you give? You give levonorgestrel, right? You are giving levonorgestrel. You are not giving ethinylestradiol. Single drug देना है. Levonorgestrel prefer करेंगे. कितना dose देना होता है? 1.5 milligram total within 72 hours. You can give as a single tablet or you can give 0.75, 0.75, 12 hours apart. The most effective is the copper T. That can be given till 5 days. Okay. What is the SPRM? Progesterone receptor modulator that is given for emergency contraceptor. What is that? Ulipristal. Okay, remember Pristal. Pristal is progesterone wala modulator. Ulipristal is what is given. Okay, Ulipristal is what is given. And if they give you ki mifepristone, misoprostol, मेटिरापोन, इसमें से कौन सा ड्रग यूज करते हैं इमरजेंसी कॉन्ट्रासेप्शन? रिमेंबर मिफेप्रिस्टोन, IFEP, I for inhibits, FE for female, P for pregnancy. So inhibits female pregnancy is mifepristone is what can be given as emergency contraception. Centroman can also be given. Okay. Now when they give you that, there's a antenatal female basically having hypertension before 20 weeks. At 14 weeks, 16 weeks, you measure the blood pressure and the blood pressure is more than 140/90 at 16 weeks. Is it preeclampsia? Is it preeclampsia? No. Remember, before 20 weeks, you do not define preeclampsia. Basically, it's a case of chronic hypertension. कि पहले से ही blood pressure बढ़ा हुआ है. Okay, it's a chronic hypertension that you are going to think about. ठीक है? Postpartum IUCD, if you want to insert IUCD in a patient postpartum, you can do that till how many hours postpartum? How many hours postpartum? Till 48 hours. We can insert the IUCD. Postpartum agar karna hai immediate, so till 48 hours. This is INICD question and we have seen in the recent FMGE exam also. What is banana sign and lemon sign? Where do you see banana and lemon? Again, remember the two fruits. हमने morning वाले session में कहाँ देखा था fruits वाला? Who loves fruits? Nikita loves fruits. The Nipah virus fruit bat. Again, remember fruit वाला यहाँ पे आएगा N. It is NTT, neural tube defect. Okay. The neural tube defect give this banana sign and lemon sign. The concave frontal bones, the curving of the cerebellum, that is NTD. Okay. Clear with everyone? Okay, next question. When they give you this in the history, okay, there is infraumbilical flattening that you are seeing in the female and fetal heart sound localized to the flank. Classical अगर जब ये देखते हो ना infraumbilical flattening. So basically you are thinking of what position? This is occipito-posterior position. Okay, this is occipito-posterior position में infraumbilical flattening is what is given in the question. Okay, remember this point. Infraumbilical flattening is occipito-posterior. Occipito-posterior. Okay. Next one. Prolapse. If there is a prolapse, uterine prolapse in a nullipara female, right? So nullipara female में you want to preserve the reproductive function. तो best क्या है करने के लिए? It is sling surgery that you will do. कि sling देके basically extra support दे दो. You do not remove any part. You want to preserve the normal function. And if it's a female who's more than 65 years, but you cannot do hysterectomy also because she is unfit for hysterectomy, right? अगर elderly female है hysterectomy कर सकते हो, hysterectomy करो. But अगर hysterectomy नहीं कर सकते हो, unfit for hysterectomy, then you will do Lee-Ford's repair. Okay, Lee-Ford's repair is done in an elderly female, right, where hysterectomy cannot be done. Okay, where hysterectomy cannot be done, right? Next one, remember ventouse, that is the vacuum delivery is contraindicated in preterm. Face presentation is where this is contraindicated क्योंकि preterm में वो bleeding के chances ज़्यादा हैं, ठीक है? And when you are putting this vacuum cup, important question, where is the flexion point? Where is the flexion point basically? So if this is the anterior fontanelle, this is the posterior fontanelle. कहाँ होता है flexion point? कहाँ लगाते हैं? Close to the posterior fontanelle, यहाँ से 3 centimeters, आगे से 6 centimeters. ठीक है? Anterior fontanelle से 6 centimeters, posterior fontanelle से 3 centimeters. ठीक है? वहाँ होता है flexion point. Posterior ज़्यादा है. ठीक है? And remember, if there is CPD given, cephalopelvic disproportion is present. What does the question generally mention in a case of CPD? In spite of the adequate contractions of the uterus, but the baby is not coming out. Right? कि contractions बहुत अच्छे हैं और उसके cervix भी dilated है. उसके बाद भी the baby is not coming out. There is fetal distress which is happening. This is a classical history given in CPD. Then what will you do in that case? You will have to do LSCS. Okay, you will have to do LSCS in that case. So remember, हम CPD के cases में ये instrumental delivery नहीं कर सकते हैं, right? क्योंकि cephalopelvic disproportion है, तो वहाँ LSCS ही करना पड़ेगा. Okay, magnesium sulfate which is given for eclampsia, right? Impending eclampsia basically where there is pre-eclampsia with seizures. Remember, for magnesium sulfate toxicity, you look for the knee jerk which gets depressed, the urine output decreases, the respiratory rate decreases. If you see this, basically that indicates that there is magnesium sulfate toxicity which is happening. Okay, magnesium sulfate toxicity which is happening. Okay. Next one, early cord clamping. In what conditions early cord clamping is indicated? RH negative female है, right? Because you do not want the maternal blood and fetal blood to mix. तो clamp जल्दी कर दो, ठीक है? So early cord clamping in RH negative, and अगर birth asphyxia है बच्चे में, you cannot waste time there. So in that case, you will do early cord clamping. Okay, in that case, you will do early cord clamping. Otherwise, we do delayed cord clamping, like 1 to 3 minutes तक करते हैं, so that ज़्यादा blood baby को जाए. So but ये cases में you have to do early cord clamping. ठीक है? Thank you so much, Dr. As. And coming to very, very important point in pediatrics, two most important points where you generally get a question in pediatrics. Okay? A severe acute malnutrition. Remember, when I'm saying that it's an acute malnutrition, that means what is present in the baby? What is present in the child? Is it wasting or stunting? Remember, it is wasting. जब acute malnutrition है तो weight कम होगा, है ना? Chronic malnutrition is indicated by stunting. Stunting मतलब stunted tree, stunted growth is basically decreased height. Okay, that's decreased height. Okay, so remember, wasting is defined as weight for height or weight for age. What is decreased? So you remember this as, because this gets confusing in the exam hall. So remember, the mnemonic is what? Weight for height and height for age. WH and HA. Weight for height indicates wasting. Height for age indicates stunting. Weight for height, height for age. It is not weight for age. Weight for age अगर कम है मतलब वो underweight है, उसको wasting नहीं बोलेंगे. ठीक है, it's weight for height. And when I say it's a severe acute malnutrition, that means how many standard deviation is it less? Severe matlab less than -3 standard deviation. Okay, -2 से है basically कम है तो wasting है, -2 to -3 it is moderate. More than -3 standard deviation, it's going to be severe acute malnutrition. Okay, for severe acute malnutrition, the mid upper arm circumference कितना होता है? Red zone में चले गया basically severe cases में, less than 11.5 centimeters. Okay, less than 11.5 centimeters plus pedal edema, unexplained pedal edema. Any of these if present, it's a severe acute malnutrition. Wasting, severe wasting, bilateral pedal edema, and there is mid upper arm circumference less than 11.5. Okay. In a patient, in a child who has dehydration and the baby is drinking water very eagerly, what is the grade of dehydration in this case? What is the grade of dehydration in this case when the baby is drinking very eagerly? Yes, what is this grade of dehydration? Absolutely right. This is going to be moderate dehydration. Okay, moderate dehydration. उसमें देते हैं plan B. Will you give IV fluid here? Will you give IV fluid here? No. Right, IV fluids is given only in severe dehydration, where they tell you कि child lethargic है, not able to drink, right? So then you give IV fluids, otherwise you don't give IV fluids. Drinks eagerly is moderate dehydration. Always remember that. Okay, drinks eagerly is moderate dehydration, right? Apart from that, in pediatrics, right, your milestones is important. We have discussed all that with the mnemonics in the pediatrics short. A lot of other important topics in peds, have been discussed there. So I'm not going into the details of all the topics, but just that whatever, my instinct was कि ये पूछा जा सकता है, and there are high chances this can be asked in the exam. Most frequently asked topics where we generally tend to make mistake is what I have covered here, right? So please try to revise all the 4 sessions of the YouTube sessions that we have had. If you are a Radsynapse subscriber, please do Sureshot very well. Quickly go through the PYQs, question answer, ताकि थोड़ी चीजें revise होती रहेगी. Right, that's what you should be doing in the last 2 days. Okay, clear with everyone? So that was about the final FMG final punch Sureshot session, guys. I hope that all these sessions help you for your exam. Just remember, it is not that difficult as it seems. Do practice Yog Nidra, like I said, do some meditations if you're getting anxious, and detach yourself from the results. Okay, that's what you have to do basically to maintain your calm. Think of the worst case scenario, ज़्यादा से ज़्यादा क्या होगा, right? So, I wish you all the best, guys. We are meeting again tomorrow for the exam hall strategy session that we have tomorrow, right? So, exam hall strategy session we are going to do tomorrow. Please stay connected, and all the very best, all the prayers, blessings, and best wishes with each one of you. Okay. So, see you again, guys, tomorrow. Take good rest. If you're not able to sleep, please do Yog Nidra. That's definitely going to help you to stay relaxed. Okay. Shivani, not only this, okay, this is essential, but this is not sufficient. Okay. So you have to do this, but apart from this, like I said, at least PYQs तो quickly देख लेना, जो आपके basically weak topics हैं वो देख लेना, ठीक है? Schedule for NEET PG will be given either tomorrow or day after. We are starting from day after, that is 12th of January. The first day is your first GT that you have to give, basically to assess where are you standing, and your proper daily targets are starting from 13th of January. Okay, so either the NEET PG schedule session will be tomorrow or day after. Annotated PDF will be uploaded on the Telegram group like the rest of the PDFs. Okay. All right. Thank you so much, everyone. And sleep well. Have a good rest. I'll see you again tomorrow for the exam hall strategy. Till then, goodbye. Take care. Keep studying. Keep revising. Keep med synapsing and keep winning. Thank you so much.